Well, a very good morning once again, and thank you for staying with us right here on Morning at NTV. We're getting into a very pertinent conversation, renewed efforts to end tuberculosis and also leprosy, an ancient disease. We do have Dr. Raymond Biarohanga. He is a senior technical advisor working with the Ministry of Health, and would like to get some information on TB, leprosy, and so forth, so that you get information on how best to live your lives. Do you know if it is detected at an early stage, you can actually beat tuberculosis? Yes, we're talking about 38,000 new infections owed to HIV. But did you know that tuberculosis accounts for over 80,000 cases of TB? Biarohanga is here. He made it. A very good morning. Thank you for joining us.
Thank you, Romeo.
Indeed.
Good morning to you.
All right, what is the purpose of the National TB and Leprosy Stakeholders Conference?
Thank you very much, Romeo. Good morning, viewers. We have a national stakeholder conference on tuberculosis and leprosy this year. We have it annually. We would like to take stock of what we've done in the last year. We would like to inform our partners, our stakeholders, and the population, the Ugandan population. What are we doing in TB and leprosy? And I think this is an opportune time for everybody to follow us on Twitter, on Facebook. We have a conference that is beginning tomorrow, the 9th to the 10th.
Are we virtual? Are we physical?
We are going to be virtual, most of us, around the country and around the world. And there will be few where we have our guest of honor will be based in Entebbe.
That is on Friday.
On Friday, yeah.
I see. So what is the purpose of this TB and Leprosy Stakeholders Conference? Let's just break it down for the viewer, because I did mention in my preamble, HIV infections are accounting for 38,000, but TB, the biggest killer of HIV patients, actually accounts for 80,000 of these cases. So break it down for us.
Yeah, thank you very much, Romeo. So we all know, and as you've said, that we have about 80,000 new infections of TB that happen annually. And as a program, and the Ministry of Health, we've gone out to make sure that we find all these TB cases. Take note that also, because this is a month of HIV/AIDS, we also very much know that the biggest killer disease among the HIV/AIDS people is TB or tuberculosis. So therefore, we are using this opportune time to come out and inform people. There is a lot of, we are doing a lot of work in the country. We are doing a lot of screening. We are doing a lot of testing using all our testing points. We have about 1,700 diagnostic units around the country. All our district hospitals, health center 4s up to health center 3s do diagnose for TB and do start patients on treatment for TB. Remember that TB is curable. And therefore, we are using this opportune time to be able to do that. So what are we doing for the next 2 days? We have what we call the United Nations high-level meeting targets that were given to Uganda. Uganda is one of the countries that signed to the United Nations high-level meeting targets for TB. And we are going to take stock of where we are before we get to the 2022 landmark. But remember that we also have COVID-19. And COVID-19, one of the biggest challenges that we have is that it mimics TB. Everybody who is coughing, chest pain, fever,
we'll just say, oh, that is COVID.
You think it's COVID, and yet it's actually TB. So what are those challenges that we have faced as a program, as a ministry, as we try to find out more TB and try to reduce TB infections that we are getting with the COVID-19 that is coming in?
I see. Yeah. And of course, during the second wave, I remember most of the cases of deaths that were coming in from Mulago National Referral Hospital were actually individuals who had HIV and TB as a mix.
Exactly.
I contracted COVID-19, but somehow I had TB and I also had HIV.
Exactly.
Let's talk about the risk adverse group, which are those ones with TB, HIV, and COVID-19. How are they pretty much affected?
Oh, they are totally affected as a population, and we really do want to target that group to make sure that they get the services that they need. And remember that we also have, where we do our diagnosis for TB is the same platform that we use for diagnosing COVID-19.
I see.
And therefore, we want to make sure that we we increase access to these services, both to TB screening and testing, as well as COVID-19, and make sure that the HIV patients that really need this service actually also access the same service around the whole country. And it's against that we are working with government, through the Ministry of Health. We're working with partners at all different levels. But one of our biggest challenges that we're having currently is the funding landscape that is still very limited. We do have an annual budget of about $70 million, and we have partners that have really supported, thanks to government of Uganda that has put in funding for the domestic funding for TB. We have partners like the Global Fund and USAID. So we really look out for more support, because our gap for funding is still very big. It's more than about 50–60%.
Indeed.
Yeah.
So what largely causes the deaths? Largely what is causing the deaths among TB patients who have COVID-19 and HIV at the same part? What happens in your system when you get invaded by that triple threat cocktail?
So the first thing is stigma. Because patients don't want to come out for testing for COVID, for fear either they are going to be reprimanded, they are going to be put back into hospital settings. So there is a lot that it has to do with a lot of stigma. We want to go out and talk to the people. We have started a campaign called the CAST campaign. That is community awareness, screening and testing for TB.
You're going to tell us about that.
To make sure that all our people out there in the communities are screened. We create awareness. We're working with the leadership, local leadership, and making sure that everybody knows about TB, so that we can reduce the people who have stigma, and people can come out freely and and are tested. This is one of the reasons that is causing mortality or death among people with TB and COVID-19.
All right, let's break it down for the viewer. What causes tuberculosis? What are the signs of symptoms of tuberculosis and so forth? How is it cured?
Thank you very much. So tuberculosis is a disease that is caused by a bacteria called Mycobacterium tuberculosis, and this bacterium is spread through the air, like COVID-19.
Like COVID, indeed.
And those that get an infection of TB are the ones who are at high risk of spreading it out to the other people. So when they cough, when they talk, they tend to cause that the spread of TB. Now, TB signs are very clear. Cough of a duration of about 2 weeks or more. At times has blood in it. Chest pain. For a high temperature, morning fevers and rigors, when you start getting chills and rigors in the morning, early in the morning. And then for children, failing to grow, they fail to grow, and despite eating, but they are failing to grow. And then there's a loss of appetite and the rest, and then loss of weight. So those are very clear signs and symptoms. And in every facility that you go to, those are the first questions that they tend to ask you at the gate or at the entrance to outpatients, and take your temperature. Now, after you found out you have tuberculosis, they take off a sample, which is usually sputum, take it for examination, and once you're found to have TB, treatment is available. We have all the treatments in all our facilities, public and private, for not-for-profit, even private for profit. We have the medicine.
Free of charge.
Free of
no
charge.
No medical officer should be asking for money.
No medical officer should be asking for any cost. And then at the end of the day, this treatment is for 6 months on average. It's for about 6 months. Apart from those with tuberculosis of the brain or the meninges, that tends to go to about 10 to 12 months. But most of the time, it's 6 months. And it can be taken and you'll be cured. At the end of 6 months, we tend to do again a test for sputum, and then if you're found to be cured, you go away healthy and normal. Now, the challenge that we have is that many people don't know that this treatment is for 6 months. We have done a lot. We are doing a lot of studies. We are doing a lot of research to decrease this treatment to even 4 months. Now, once that is done, we clear you, and at times we even give you a certificate of good health, and you go away and you are healthy. Yeah.
I see. Is leprosy the ancient scourge, Biarahanga, still with us? And how so?
Yes. So we still have leprosy with us. We have leprosy in West Nile region. We have leprosy in southwestern Uganda. The challenge with leprosy is that we still think that it's an ancient disease. So most of the time it presents as a skin lesion, a small skin lesion, and many times many of our health workers do not understand what this lesion is, so they really treat them as a skin disease.
So let's break it down. What causes leprosy? Signs and symptoms, if you will.
Leprosy is also another disease that is also caused by a similar bacteria like the tuberculosis bacteria, but this time it's called Microbacterium leprae, which means that it's similar. That's why they have put these two diseases under the National TB and Leprosy Program, and the medication is the same. So usually, most of the time is leprosy. The signs are very. It begins as a skin lesion, and eventually you start getting numbness in your skin, and you're able to. With that, if you're able to see a clinician, and the clinician knows these signs and symptoms, usually takes off a swab, examines it, and usually finds this bacterium on microscope on those lesions. And the treatment is almost the same as tuberculosis, and you can be cured and get healthy.
Indeed.
Yeah.
So talk to me about the campaign to end TB in Uganda. Testing, the CAST program.
Yes. So we have a campaign that we've started.
Indeed.
We started it during the COVID time when many of our patients were not able to come to the facility. But we wanted to create awareness and make sure that everybody knows about TB. We want to make sure that everybody is screened and tested. Services are available everywhere. We have X-ray services now around the country. We have a gene expert that we use that are around the country. We have microscope. So we have decided to go out on a regular basis, 6-month basis, to make sure that people in the communities get out, come to the facilities, and get tested. And those that are found to have TB are started on treatment. Those that are found not to have TB, especially the high-risk populations, let's say the people living with HIV, diabetic patients, and others, and children, we want to make sure that they get preventive therapy. That's preventive treatment for them not to contract TB. And it's readily available. It's just taking your 1 tablet once a day for 6 months, and you're healthy, and you'll not get TB.
But in January of 2020, all the way to December, we missed over 10,000 cases of TB because we didn't have a CAST program at the time.
Yes.
Yes. So 10,000 cases of TB were actually missed out.
Yes.
How dire is the situation?
And that is
because we are just launching the CAST program.
We are attributing that big time to COVID-19.
I see.
Because many patients stayed behind, were not able to come for the service, and as a result of that, we not only did we miss 10,000. On annual basis, we've been missing about 20,000-30,000 TB patients. It was a good opportunity for us last year when we started the CAST campaign, the community campaign, that we were able now to reduce that number to about 10,000. But we need to find every TB case in this country. And that calls for now for us to move a gear higher into the CAST campaign.
Indeed.
To be able to make sure that even those people that are not coming for TB services, those people that are not coming for screening in their communities, we are able to reach out to them through our village health teams, through our community health workers, to be able to see that they get the service, and if they are found to have TB, come to the facility for treatment.
All right, look out for the launch of the community awareness, screening, testing, treatment of TB, because this is a campaign that we are launching to end TB by the year 2030 in that regard. In my midst is Dr. Raymond Biarahanga, the Senior Technical Advisor at the Ministry of Health. Well, the community awareness campaign, is it also going to be traversing the jurisdictions of the prisons? That's what we would like to know. The people in the prisons, you know how congested the prisons are. Just one TB case can affect all the prisoners.
That's very true.
And I know Johnson Biabashaija shall be gracing this event.
Yes, we shall have.
Yes,
we shall have a very good, strong team at the.
But before we unpack it, let's go to the prisons.
Yes.
So, how dire is the situation of TB prevalence within the prison settings?
Interesting. Thank you very much, Remio. So TB in prisons is very high.
I see.
The prevalence is very high, and simply because this is a congested community, and one TB case in that community, you'll tend to see very many people getting infected, and that's why you'll see that during the COVID time, they had to have a lot of infection control procedures that were done in prisons to make sure that COVID does not enter prison. But at the end of the day, it does go through.
Indeed.
So we know very much that prison is one of our high-risk population. Prisoners, or even the prison warders, are one of the high-risk populations for TB. And as a result of that, we are supporting the Uganda Prison Services to make sure that all the prisons around the country have access to diagnostic services, have regular screening of the prison inmates, to make sure that those that have TB are isolated and put in a separate isolation room and access treatment from day one up to the last day. And we have seen tremendous improvements in that, because once you isolate, once you screen and you pick up 2-3 TB patients, you are able to prevent the others from getting TB, and once you start these people on treatment, they have always got cured. We used to see a lot of mortality in prisons due to TB. We're seeing now very few. We are going to be graced by none other than the
canon,
the man himself,
the
to be able to talk to us, to be able to talk to us about TB in prisons. And the biggest advantage where we have Johnson Byabashaija at this event is because we really want to see Uganda Prison Services and the prisons world over to see how can we reduce tuberculosis. The moment we reduce tuberculosis infections in the prisons, even as a country, we shall see ourselves reducing in terms of the prevalence of tuberculosis.
Of course, given the small, places where they live as prisoners, it's actually good ground for the manifestation of TB, but also COVID-19. How big of a threat is COVID-19 to people who have TB in this regard? Because we know it's killing people with comorbidities.
Yes. So one of the biggest threats of COVID-19 is because it tends to have a similar manifestation. And we are now seeing a lot of change in COVID-19 because of vaccination. So we still think that we still need to work very closely with our colleagues in the COVID-19 task force. We need to make sure that the same health worker who is seeing a TB patient is also aware of how to screen and test for COVID and manage COVID.
So meaning, as you test for TB, you should also be able to test for COVID-19 or even leprosy.
Or leprosy. Or if you are testing for COVID-19, you should be able to test for TB as well.
At the same time.
At the same time.
I
So
see.
it's a bidirectional kind of screening to make sure that we do not miss any patient. And once we have the patients that have COVID-19 and have tuberculosis or co-infected with both, we manage them the same way. We make sure that we give them all the medication, we give them the fluids, make sure that they are healthy, and then we'll see a reduction in mortality.
Indeed. Who are some of the other guests who are going to be gracing this?
We'll be having academia there.
All right.
That will be giving us a lot of information.
So actually it's right there on the list.
Yes. We will have the media. The media, a very important player in this field, and we'll be expecting, we're hopeful that we are going to be showing it live on NTV, on UBC, and other televisions. We'll also be having our guest of honor will be the Honorable Minister for Health, and we'll be also honored to be having WHO there to really talk about how do we end TB by 2030. So we'll be having a very good panel of speakers, and we do hope that people will be able to listen in and understand and be able to even ask some questions.
And of course, during this conference, the biggest conversation is going to be transpiring, and that is how we can expedite a PPP to see how best the Minister of Health can work with these private players in the health sector. We all do know that the first call for a TB patient or an HIV patient or a COVID-19 patient is the nearest health center, and most of the times it is a private center in that regard. So talk to us about private health provider management in that regard.
So we as a Ministry of Health, we are actually working very closely with the private sector, and would like to really engage more of the private sector. Studies have shown, and we've done our studies in terms of, even in our national strategic plan, we've shown that 50 to 60% of the patients, TB patients, first go to a private clinic.
Indeed.
They go to a drug shop and they get treatment for their cough. before eventually they come to the facility when the cough has not healed. And we're now looking forward to making sure that we engage this private sector to do screening, to do testing, so that they can, and even start giving patients treatment as a private, public-private mix. And we have started already working with the big facilities in the districts, especially in the cities. We have started working with the private clinics and the drug shops, and we want to really scale it up so that they can be our partners. And these are one of our greatest partners to make sure that eventually we are going to find those that are missing out on TB services in the public service that are going in the private sector.
Okay, so here we are with people missing out on TB services. Let me take you to the refugee camps. Let me take you to BDBD. Let me take you to Chaka, Refugee Settlement, and talk to the refugees in there. How dire is the prevalence of TB within these jurisdictions, the refugee settlements?
So one of the biggest transmission factors of TB is actual congestion.
I see.
The other biggest factor of TB is that if there is no ventilation system.
Indeed.
So among the refugees, because of the congestion that they have there, we do believe that there's a lot of TB, and indeed there's a lot of TB.
Indeed.
So we're working with the United Nations UNHCR to make sure that we screen. We at the border points we're screening. We were working with UNHCR to make sure that treatment is available. We're working with the same refugee camps to make sure that all our facilities, the public facilities around the refugee camps, are well equipped, well supplied with medicines, well trained health workers to be able to handle the refugees in case they have tuberculosis.
What are the factors precipitating the increase of these TB cases within these refugee settlements?
So one of the
besides the congestion,
one of the big factors is that the countries where they come from,
DRC,
DRC,
Rwanda,
South Sudan,
yes, I see.
Somalia. Most of the time, their health system is still not that strong enough to pick up these TB cases. So many of these refugees are coming with tuberculosis. Many of these refugees have,
even as they move in groups,
they are infecting themselves because of that. And so when they get into Uganda, there's a lot of already tuberculosis that is moving among them. And therefore, we are looking at making sure that as they get in, can we do some screening at the border points to include tuberculosis, not only COVID, not only skin diseases.
So you're saying initially the reason why the cases entered the country was because when these people moved across the border, we did not focus on TB. We first focused on COVID-19. And they entered with that TB.
Yes.
And then it spread.
And then it spreads in the camps.
I see.
And you know, because of our policy as Uganda with the settlement, because they don't just only stay in the camps, so they move out of the camps and into the nearby communities. And that also creates a big transmission of tuberculosis. So we are really working to make sure that we do screen, do test, do prevent, or do give treatment to those that have TB within the refugee camps, and so that when they come out, they do not spread it out to the rest of the population.
What are the expected outcomes from the conference that we are expecting on Thursday and Friday?
So we're expecting a lot of first of all, we want to make sure that we disseminate what we've been working on. So we'll be giving a lot of information to the listeners and to those that are attending the conference.
Yes, Doctor.
But one of the very critical things that we really want to tell the population and the people out there is that we need more resources.
I hear you on that one. Funding.
We need more resources.
GBV, leprosy, TB, money is the issue.
We cannot do this without partners.
Indeed.
And stakeholders. Everyone is a stakeholder, and we really need to see that we all get together to be able to.
So would you be part of the, maybe technocrats and government officials who can actually ably tell the government to remove the clampdown on the NGOs? Because some of the NGOs that were shut down in August, the 54 NGOs, were actually helping you in advancing these social services. TB information, leprosy information, COVID-19 information. Would you be in a safer position to advocate for the removal of the shackles on these NGOs?
We're working with the civil society, and we really appreciate the civil society additional response to the COVID-19, to the TB pandemic that we have. I do advocate a lot for the civil society.
Thank you very much.
And I would want to see a lot of the civil society getting down to work in the health sector, as long as they remain transparent and work with government.
And they don't put in politics in
And they don't put politics in health.
What are some of the activities that will take place at the conference?
So we'll be having a show, we'll be having a display, and we have quite a very good number of health equipment that is going to be displayed. But we also have very good interactive and very good speakers that we'll be having on that day. We'll be having the Global Fund that will be talking to us. We'll be having the U.S. ambassador as Her Excellency will also be talking to us on that day. We'll be having, as you've said, the Uganda Prison Services. We have a very good keynote speaker.
Of course, the academia is going to be there. Dr. Katamba Achilles. We cannot let you go minus interrogating the role of the academia in keeping TB in our sight. Yes, we have a minute. We have a minute left.
Thank you. So we have the academia that has been working with us in different researches, and we are getting there in terms of research and innovations. We have the Achilles Katamba, the Makerere Lung Institute, that we are talking about a lot to do with treatment outcomes for our patients that are out there in the community. They have done very great work in making sure that they use technology, the smartphones, in making sure that patients get to know when they are supposed to get their treatment. So there are going to be a lot of presentations from the academia in terms of the researches they have done, the medications they have introduced, and the different technologies that we have.
Of course, better research translates into better medication and technology to help us clamp down on the problems at hand, leprosy and TB, ending them by the year 2030.
Yes, exactly.
Very insightful conversation with Dr. Raymond, Biarahanga. He is the Senior Technical Advisor working with the Ministry of Health. Kind regards to everyone at the Ministry.
Thank you very much, and looking forward to having you there in Entebbe.
Indeed, my brother. I'll be there.
Thank you.
All right. That is it for